Okay, we'll call the meeting of the Metro Social Services Commission to order, please. The first item on our agenda is the approval of the February meeting summary. And I'll now call the roll of the attendees and ask for your vote on the motion for approval. I'm going to call for approval. Motion first. Do I have a motion for approval?
So move.
Second. Do I have a second?
Second.
Thank you. Now I'll call the roll by name of the attendees and ask for your vote on the motion. Chairman votes aye. Pastor Harris, how do you vote?
Aye.
Mr. Orr, how do you vote?
Aye.
Tompkins, how do you vote?
Aye.
Okay, the motion carries. I now need to read a statement since we are meeting electronically for the first time. And just before I do this statement, I want to thank all the Metro Social Services employees and staff and everyone who's helped us organize this and for all the work that they do day in and day out to serve our clients and to meet the needs of our community. I move that the items on the meeting agenda constitute essential business of this board. Meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans considering the COVID-19 outbreak. And any rule conflicting with the governor's executive order permitting electronic meetings is suspended. So I will call for motion for approval.
So move.
Second. Okay.
Second.
Thank you. Chairman votes aye. Pastor Harris, how do you vote?
Aye.
Mr. Orr, how do you vote?
Aye.
Tompkins, how do you vote?
Aye.
The motion carries. We'll now begin the remainder of our agenda with the finance report.
Good morning, everyone.
Morning.
Morning.
As we're nearing the end of the current fiscal year for 2020 and preparing for our upcoming fiscal year, I want to focus today's financial report on the upcoming budget for fiscal year 21. However, before doing so, I would like to bring your attention to the financial report you all received in your package and highlight that we are coming in under budget overall by $827,119. Although you will notice by program that both the warming shelter and the indigent burial program remain over budget, which I believe is no surprise to any of you. We have been fortunate in that a great deal of our expenditures have been reclassed and redirected to a newly created COVID-19 fund that doesn't directly impact our current operating budget, and that too attributes directly to our coming in under budget this current fiscal year, along with the current vacancies and open positions and the contract spending reduction. That being the case, as most of you are probably aware, the mayor's initial recommended budget was not adopted or approved by council, but instead it was Councilman Mendez's substitute budget that passed. And I want to preface this information by stating that as of today, there has been no official information or funding details released by OMB as of yet. But in terms of Metro Social Services fiscal year 21 budget, we ought to receive an additional $100,000 in funding for our burial program, and that's in support of the growing demand for services due to the increase in migration and the changes in Davidson County's population. Additionally, there will be a $200,000 reduction for the elimination of community partnership funds, along with the $450,000 elimination of the direct appropriation for the guest house at the Room in the Inn. As for general government employees, unfortunately, there will be no longevity pay for fiscal year 21, as well as no merit increases for either open range employees or step increments. There will, however, be a 1% cost of living adjustment for all Metro government employees across the board that will be effective 7/1. Somewhat switching gears, I want to briefly speak to the department's goal and plan for restructuring our administration division, more specifically our business office. I want to thank Ms. Pratt for her continued support and confidence in me to be able to lead and serve as the Director of Administration. In this role, I will oversee both the human resources and the finance functions for the department. I am very pleased to share that we have a finance administrator who will be joining our team as of Monday, June 29th, so that's very exciting. We are centering our finance office around a team concept. You may have heard Renee kind of mention some of this in the past, and that's going to be inclusive of myself, the finance administrator, we have a payroll specialist, and then one other potential finance officer. And with this new team approach, the whole premise is that we will all be cross-trained on all of the duties that fall within administration, with the ability to serve as a backup for one another, so that in the event of any one individual being absent, we can kind of keep the ball moving seamlessly. That pretty much kind of concludes what I want to focus on in terms of the financial report. So at this time, I'll open it up to any comments or questions.
The chair would just like to comment on this restructuring. I think an excellent idea. I especially like the idea of cross-training, and I think this benefit to the department. Your efforts are very much appreciated, and your willingness to take on this role, and I think it will work out really well. Thank you. Any other comments, questions? Okay. Hancock, thank you so much. Appreciate your work. The next item on the agenda is the director's report, and I'll ask Ms. Pratt to give us that report. Thank you.
Great. Thank you so much, Commissioner. Please allow me to echo your words of thanks to Yuri Hancock for all her hard work over these past few months and stepping in and assisting us with preparing the budget and finally looking at year-end as well. She's made such a major difference in that particular area to be able to step into finance and assist us as a department. So we truly appreciate that, and congratulations on her promotion. Also, I'd like to take this opportunity to say thank you publicly to staff. We haven't met, the board hasn't met over the last few months, so a lot has gone on. I'm pleased to say that we've kept our doors open during COVID, and we are seeing customers by appointment only. We've also been right out in the midst of the community as it relates to the tornado effort. On March 2nd, the tornado came through, and the second day of the tornado, we were able to get out and provide meals to our community as well. If we weren't able to drive in the community or in the neighborhood, our van drivers would get out of the van and actually walk the meals to our customers. So I truly appreciate their effort and their commitment and dedication to ensure that our customers are safe and that they will be provided for. So a major thank you for that as well. We've also manned the homeless shelter. The homeless shelter was a result of the mission asking the mayor's office for help with social distancing at the mission. The fairgrounds was opened at that time. They opened on March 26th to men and women that came from the mission. They've been there since. The shelter's been open 24 hours, 7 days a week. So we are very grateful to staff that have manned that effort and have kept the shelter going, along with temp agencies and other staff from other community partners as well as other metro departments. So we truly appreciate that effort. And again, thank you to all the hardworking essential positions that we have in the organization to ensure that we continue to serve our community. Again, on March 2nd, the tornado devastated large areas around Davidson County communities. Households, individuals experienced severe disruption to their lives, losses to homes, and to livelihoods. Our building was damaged in the storm here at Metro Social Services, and unfortunately, we were not able to get into our building for 3 weeks. So we were actually in the tornado-ravaged areas, working in the actual communities, providing service. We specifically were in the 37208 area, where they were severely hit. On the ground, our staff was canvassing to ensure people were getting what they needed in terms of resources and referrals. We were also privileged to use Commissioner Harris's church as an office. He offered his assistance to help us as we were displaced. So we were there for almost 3 weeks, working out of his office and seeing customers and assisting people in the community. So I just want to take this opportunity to say thank you to Commissioner Harris for his help, for his guidance, and his wisdom in leading us in that effort and providing us with information that will help give us some relief in that particular area. And I must say, we are continuing to work in that area. We are in the process of reaching out to that community. I've also had a conversation with Pastor Harris in terms of needs. When the tornado struck and there was efforts around the tornado to rebuild, and then COVID came right behind that, and some things got kind of stalled and things haven't been done, and we really don't know what's going on from a social services perspective. So we're trying to gather that information and determine what the current needs are in all the tornado-ravaged areas. So that's what we're working on now with staff and with our strategic planning and research department as well. We've also developed several infographic materials that have gone out into the community, as well as they're posted on our website regarding the impacts of the tornado on various populations. This was distributed to over 4,000 recipients, providing a current assessment of economic impacts of the tornado and COVID events on groups most likely to be adversely affected. We've also conducted a virtual release of the 2020 Community Needs Evaluation. This is our 11th edition of the Community Needs Evaluation. It is posted on our website if you would like to access it. We will also are planning on presenting a webinar over the next month or so on the Community Needs Evaluation and the information that we found from last year, along with census data, socioeconomic data, and demographic data as well. So you'll be seeing and hearing more to come about that release. We've also fully staffed the overflow shelter, and I'm pleased to report that the people that are working the shelter and have worked with the homeless population are eligible for hazard pay. So we are really excited about that opportunity and really appreciate that there is some effort being put forth to reward those employees that are actually on the front line and that they are the ones that are essential workers. Our strategic and planning research staff has participated as members of the volunteer organizations active in disaster, the VOAG, since its inception following the tornado. The VOAG was designed by the mayor to coordinate activities addressing all types of needs of affected populations and communities. Social Services has been designated as the key data resource for this initiative. And that is a weekly call that we are on, sharing information and resources that will help the community as it relates to disaster. And finally, we participated with key local initiatives and offices addressing recovery from and impact of both events, including with the Middle Tennessee Donors Forum, Mark O'Brien, the Mayor's Office, and others. These have included exploration of data and research oriented towards new insights into service delivery for populations most affected. And finally, I'd like to report over the next month or so, you will be hearing from us to establish availability of dates for a spring retreat, a summer retreat over the next couple of months. So our next board meeting might be that retreat. It just depends on if we have to have a virtual meeting or not. So you'll be hearing more about that as time goes on. Also, we're in the process of reviewing our last strategic plan. We are coming up on 3 years with that plan. So it is time to look at our accomplishments, determine if our goals were met, create our baselines, and get that information out to you. So we're working on that as well. And then we will start a new series to prepare for the strategic plan, including our staff and stakeholders, Metro partners, and community partners for their input as it relates to the direction Metro Social Services needs to move in as we continue to address the many needs of our constituents here in the Davidson County area. We're extremely excited about the opportunities around social planning and looking forward to working in the community and addressing needs that come up every day as we move through the social services planning process. The last thing I'd like to remind you of is you are required as a commissioner to attend board training that is presented by Metro Human Resources. You will receive information on that over the next 2 weeks or so we can set up the time where we can go ahead and have you receive that training. Other than that, that completes my report, and I will take questions.
Any questions or comments for Ms. Pratt? The chair would just simply like to follow up with a statement that we appreciate the leadership here in Metro Social Services. Without leadership, we don't do as good a job. We've got great leadership. We've got great staff. I know I've been in contact with Ms. Pratt back when the tornado struck and getting information from her about the activities staff were doing. And I just want to give them a great compliment and recognition for what they've done and what they continue to do. Any other comments?
I'd like to add, effective last week, we now have a new commissioner, Commissioner Mike McCurdy. He is CEO and Director of Family and Children Services. Unfortunately, we received his information a little late, and we were trying to reach him at a different number, and unfortunately, he's not able to attend this meeting, but we will definitely have him included in the next meeting as well. Also, would like to announce that Commissioner Tompkins was reappointed. So thank you, Commissioner Tompkins, for agreeing to serve an additional 5 years. We do appreciate that. And it is with a heavy heart that I announce that Commissioner Moncrief was not reappointed to the commission, but he was such a wealth of knowledge and information for us as a department, and he has agreed to stay on in an advisor capacity and continue to work with us on the efforts around strategic planning and resources. And he has agreed to do whatever he needs to do to help us successfully complete whatever we decide to do as it relates to strategic planning and research and to Metro Social Services. So I'd like to publicly again say thank you, Commissioner Maxey.
Chair, also, one other thing, would like to thank Pastor Harris. In times of crisis, he stepped up, providing space for our staff to work at his church, and he is truly a blessing to the Nashville community. So thank you, Pastor Harris. The next
My
item,
privilege.
yes, sir, thank you.
Thank you.
The next item on our agenda is the Homeless Impact Division, and Ms. Judy Hackett will be giving you her report, and you may start now. Thank you.
Hi.
Thank you.
So
Welcome.
I'm like coming in and, looking around, so I want to thanks for giving us this opportunity.
Microphone.
Yes.
Okay. Okay. So you have received a written report. I wanted to highlight some other things, and one of the things is Metro Social Services, if you recall, was asked to submit to Metro Council by May 31st a cold weather report and cold weather sheltering. So what we've done, because that really was, COVID happened right in between. So what we have done is submitted a report based on last year's approach. And then we did some additional, we included an evaluation and an assessment, and just to highlight the operational costs for 18 nights were $160,000 and an additional $45,000 for material costs. That is spread across different departments, that cost. And so, however, we believe that the COVID-19 pandemic, we really need to watch what's happening right now with the Metro shelter currently and really reevaluate what needs to happen with the winter shelter approach. And also with the systems approach, with the additional dollars coming into Metro through the CARES funds. It's also an opportunity to really evaluate what our system looks like, what the sheltering looks like, where the gaps are, what are opportunities with those funds to really focus on getting people indoors and into housing. On that note, Metro has received hot technical assistance. We have been working with them since the tornado, then shifted to COVID, and now they're really working with MDHA and the Mayor's Office and MSF to look at long-term funding prioritization and focus on the Emergency Solution Grant. So generally for this community, Emergency Solution Grants are administered by MDHA, the Metropolitan Development and Housing Agency, and generally, and this year we got an allocation for Nashville that was $450,000. Now through COVID, there were 2 rounds of additional ESG. ESG stands for Emergency Solutions Grant. Round 1, Nashville was allocated an additional $1.5 million, and in round 2, another $8.5 million. So that's a total of $10 million. That I think has about 2 years to be spent. This is eligible activities include emergency shelter, street outreach, expanded staff, rapid rehousing, prevention. Those are the focus that we are working on with the technical assistance provider from the Department of Housing and Urban Development. And then also, since I'm already going through that, Nashville received an additional $5.3 million, in general, actually, Nashville receives usually $5.3 million in CDBG dollars, also through MDHA, that's Community Development Block Grants, and they received an additional $3.1 million. So this technical assistance is looking at those emergency solution grant dollars and see how it can be leveraged and how it fits into the bigger picture with the other additional funding that Nashville is getting through COVID. And we are on the calls. Director Pratt and I are on the leadership team on that to advise and assist with data, anything that's needed, and just we are on those weekly calls as well. We are also right now looking at hot weather, and I had this week a call with providers, outreach workers on brainstorming what needs to happen during hot weather. I have reached out to the libraries to see, because their opening does not adjust, is not aligned with the phased opening of the city. And so it's important that we are prepared and know what different organizations are planning around helping people remain cool. One of the main focus that I have spent a lot of time on is encampment situations. So as of yesterday, in your report, I gave you some numbers. I updated those based on the call from yesterday. So we have identified up to 560 people that live in encampments. Encampments we identify as a structure, some structure where people are living in. 3 of those encampments have populations of 40 or more. The largest one has 75 to 100. Overall, I think it's about 86 established encampments that we identified and that we are trying to coordinate with outreach groups on who's providing services. Services are not delivered in the same way because it's really, Nashville has developed a handbook, pandemic handbook for outreach workers to protect the encampments, people living there, as well as protect the outreach workers. So there's a lot of going on with encampment coordination and what needs to happen. So if you have any questions, please reach out to me on that. Those conversations are ongoing. One of the other things that I'm actually excited about is, well, I'm excited about a lot of things, but this I'm really excited about is a partnership that we entered with Community Care Fellowship. It's also known as Ken & Carroll, that organization. They're usually a state center program, and they have shifted to really focus on housing and assisting people with housing. They have partnered with us to do a pilot project on motel vouchers. It's a very small project, but we helped put a model together and a budget together to get people. The goal was use coordinated entry, the process, identify people and refer people through to those motel rooms through coordinated entry and then evaluate that. We partnered with Bloomberg Associates to help us evaluation tools, and the funder is the Frist Foundation. We're going to give them an update this week. What we found is, so we've reached the goal of getting the most vulnerable people off the streets, but most of them have already a housing navigator in the community. So partnerships have formed to really, housing navigators really appreciate to know where the people are located, work with them intensely in that location, and then Community Care Fellowship hired a coordinator to work with the motel. The motel itself, they already have security and they are familiar with the homeless population. They've worked with them before. And so we found that actually our initial budget of $40,000 could be reduced, and we're really working on a model that we want to call it a mobile navigation center. How can we serve people in encampments and people that fall through those gaps and cannot access traditional shelter? This is really going to be also a data approach. The goal is to get people into housing as quickly as possible, measure that. And so I'm excited to look at that further, see what the model is and how that could work within our system. I also wanted to mention the general continuum of care funding allocation for Nashville has increased again this year. So from about 2 years ago, it's increased for a total of 22%, and that was announced before COVID hit. So that's the regular allocation. So our allocation went from $3.2 million 2 years ago to $3.9 million this year, and we expect it to increase to $5.4 million next year. And I really want to credit that to the community's systems approach to moving from the siloed approach and really focusing on coordinated entry to the changes we have made with the homeless management information system and the focus we have put on that. I really feel all of that the federal government has seen what progress and what we invest in, so they were willing to invest. Just to remind everybody, there is a given amount of set of funding, so for us to get an increase from other communities, not a decrease. And that's probably, it's really hard to do. So I think Nashville can be proud of itself for taking this systems approach. I also, at yesterday's leadership call, it stood out to me that the HUD technical assistance provider suggested an approach for Nashville to look at the funding the COVID funding in care dollars, and said this approach would only be possible if where we are at Nashville. If we were siloed, it wouldn't work. So even there, while a lot of times we do not realize how much we changed the systems approach already, it does pay off. And that's kind of the report I have. If there's any questions or if
Any comments, questions? Ms. Hackett, thank you very much for that report. Very detailed, very encouraging too, in terms of some of those numbers. So thank you.
Thank you.
Next item on our agenda are program reports. Ms. Wilson?
Hello.
Carol Wilson and Lonnie Wade, thank you. Welcome.
Good morning.
Ms. Wilson, you may start anytime you want.
All right. I'm going to start off with the nutrition report first. Just want to give you some backup information from the fiscal year July 1st, 2019 until the current month of May 31st. I'm so fortunate to say that we were able to provide 145,350 units of meals to 766 seniors, which is unduplicated numbers. These are seniors that were participating at the congregate meal sites and also that are homebound seniors. So we have not missed giving out meals to our seniors. However, during this pandemic episode, the seniors would continue to receive the meals. So I just to give you a guideline of information of how many meals we have provided since then. During the month of March, we started March to 17, basically the COVID meals began for us. During the month of March, there was 2,183 units of meals provided to our seniors. Ms. Wilson, you might want to share that we got additional COVID meals for COVID. So you might want to talk about our funder and how that came about to provide those COVID meals.
Sure. What we received was throughout the grant funder, which is GNRC. We was able to get a Family First, also a grant that will provide meals to our seniors to cover most of the COVID. Along with that, we was also approved for our grant to continue through 2020, year 2022, that grant was $1,068,305. So that will cover the meals, the COVID meals so far. We will continue to add on new people as they're needed for the meals. We are focusing more so on preparing hot homebound meals to most of the COVID seniors right now. So there has not been any delays with our seniors getting their meals through our senior program. And want to say thank you also to TCAD for also sponsoring the Family First grant unto us and GNRC as well. Any questions regarding the nutrition program?
I would just like to say as well, we've been approached, we've received some phone calls from the public and also from other metro departments as well as the mayor's office asking for us to possibly assist in delivering meals to people that were COVID positive. So early when COVID started, there were just a handful of people that did need meals that did test positive for COVID. And our staff did take that on as well and deliver meals to those COVID positive people in the community as well. So again, essential staff doing an essential job to ensure people are fed. So just want to say thank you to the nutrition program and to staff. We did not take on any additional van drivers to deliver these meals or any additional help. So we've absorbed that and those meals have gotten out as well. So, and they are hot meals.
Yes.
So again, thank you so much for that effort in nutrition. I appreciate it.
Thank you. And also at this time, I'm sorry, Commissioner.
No, I just wanted to compare what Director Pratt said. To me, it's amazing, actually, what you all do and how you do it, and how well you do it.
Thank you.
And of course, I've known you and I've known that operation for some time. I always, you get an expectation built for service and quality service and dependability, and but then things happen like the COVID, tornadoes, these unexpected things happen. You go, oh, well, things will fall apart. No, not here. Not here.
Thank you.
They
Thank you so much.
And things that get better. I'm sorry, I don't want any more problems, but, the staff and you and all the managers are just doing a great job.
And that's true, and I want to say thank you to Ms. Pratt as well, and also to Mr. Mitra Bond. That's been very significant and vital in making sure that meals go forth, and that's very commendable to say as well. So we have a strong support system here, and I'm glad to have that done because we could not do it without you all as well, and thank you, Commissioner. The other piece I want to talk about is the indigent bearer. We're still providing bearer services to those who are able to afford respectful burials. So over the past year, we have provided 142 burials and 44 cremations. Through the COVID process, we only had one COVID person for the month of May, but we will continue to provide those indigent burial services as well as needed. So that concludes my report.
Thank you for the excellent work in that program.
All right, thanks.
Thank you so much. Okay, now we're going to hear from Mr. Lonnie Way. Lonnie, welcome. Thank you so much.
Welcome. Am I okay to pour this out a little bit as I talk?
Yes, sir.
It's a little bit easier.
Back up. I don't want to get used to it.
I will back up as well. So I'd first like to start off by saying I hope and I'm grateful to see that everyone is well, and hope that continues to be. Just want to give you a couple of updates in the family support program. And I apologize if I pause. I'm still kind of breathing through the mask, and whenever Michael, okay, so I've been given the okay to actually kind of just pull it all the way down. So,
The glasses fog up.
Right. The glassware, right. So just a couple of things. One, we're definitely continuing to reiterate the wearing of PPEs as we continue to provide services, continuing to encourage, staff to definitely make sure that they're social distancing, as well as, doing a lot of the cleaning of their personal space, as well as our common areas. And not only that, but also encouraging them to, do proper workplace etiquette in terms of washing your hands. If you can't do soap and water, CDC guidelines, make sure you get some hand sanitizer and do all those things as well. So we're definitely doing that because that's very vital into us being able to continue working with the customers that we work with. We have made some slight adjustments in terms of how we are seeing our customers. So we are now just kind of working off of a scheduled appointment only. However, our customers will call in and we place this information just in case someone does call in or someone does walk into the building, and the front desk, whether it be security guard desk, will let them know to make a phone call so that we can schedule an appointment for them to be able to, see a social worker. So we haven't stopped any of those services at all. There's just been an adjustment in terms of, no walk-ins versus just going to scheduled appointments. However, we have been alerted to a couple of incidents where people have come down. I think there were 2 from the mayor's office and just one that's the general walk-in, and the person really needed to see someone that at that time, and we were able to, accommodate them and still let them in, provided them with a mask because they did not have their own. And that's something that we're going forth and doing as well is, if we're encouraging customers, if you have a mask, make sure you wear your mask. If you have a bandana, if you got a shirt, I tell people do not wear old dirty socks over their face. It's not going to be good. But if you have something that could, potentially be a facial covering, and we'll definitely, if they don't have those, we're definitely going to provide those to them as well. So that's one of those things. In addition to our adjustments, we're encouraging staff to, over the phone, get as much information as possible. So where we would typically do our assessments and our intake process, in person, face-to-face and directly, we're trying to get much of that information over the phone. That way, when they schedule the appointment, the only time that they have to spend in the building is as little as possible so that we can, do the direct things, i.e. if I need you to sign something, if I'm providing you with, information or something like that, it makes the process move a little bit faster. What we're trying to do is limit those to hour increments so that, we have enough time to fit, more people in throughout the day. In doing so, we're also encouraging staff to utilize telecommunications apps, i.e. Zoom, Google Duo, Hangouts, Microsoft Teams, Skype, FaceTime. Some staff have actually completed such interviews. I was actually able to sit and observe one interview for our conservatorship program, which actually went pretty well. Out of that, we actually asked those 2 individuals who did the bulk of those to create a document on protocols for just, proper etiquette in doing, telecommunication app interviews. That document actually was finalized yesterday. We sent it out to staff for them to review so that they can have that to use just to increase or to better skills in terms of interviewing in that aspect. In addition to that, we had a training on compassionate interviewing as well as empathic listening. If I can, I know I may not have a lot of time, I can get laborious and I can start talking. So I'm going to try to keep it fast. But the reason that came about was, I know it's not strange for everyone. We know that a lot of people up and through the months of March, probably April, May, maybe a little bit of June as well, they were granted some reprieve from either evictions, cut-off notices, things like that. And we know that a lot of the customers who were affected during that time may not have been customers who would have contacted social services departments or agencies in general. But I own my business, and because of the COVID-19, my business was shut down, or I was not able to go to work, and I had a job that was consistent for so many years. So we know that we're going to get a lot of people who aren't, for lack of a better term, used to utilizing our services. So we wanted to, equip staff with, a little bit more support to help them be more sensitive to that demographic of people. So we kind of enacted the training for the compassionate interviewing, as well as the empathic listening. Just to reiterate, when customers call in, make certain that you basically express and help them feel the need that we are here to help. That's the only thing. And two things that I really appreciated that came out of the training. One was from the movie Do the Right Thing. Basically, you have a choice: be right or do right. Bottom line is, we want to do right. So whatever it may be, we definitely want to be those individuals who are doing right by the customers. And then the second one was, we just want to make it better. So when I call or contact or speak with that customer, whatever I do, I have to leave that person in a situation where I have made the situation better. Whether it's me providing that information, providing hope, navigation of services, but those are the two key things that I kind of really took out of it, like definitely make sure that we at least do those things. So those are just some of the things that we kind of enacted. Numbers were down for a while. I believe a lot of that was due to, the enactment of, social distancing and the initialization of the mayor's safer at home order. But as, the Nashville started to reopen, we started seeing increase in customer phone calls, people wanting to, come in and utilize services. So cases are being opened. We're continuing to go forth in that regard. We had seen a huge increase in our phone calls, especially on our CE line, but as well as our general line as well. So those are some things. And I did want to just kind of leave, I know you have this on your numbers, but I still find it impressive that throughout all of the tornado and the pandemic, we're still able to get people housed. So while the numbers don't look like what they used to, people are still receiving that service. 3 people for the month of April, which we know that was probably at the height of our, social distancing and safer at home, and 6 people for the month of May. So we'll continue to see those numbers climb. We're continuing to work hard at assisting people and just being creative in how we do that. If people can't come in the building because I don't have a mask, and me putting on a mask is going to cause a health problem. We're going to go out to your car if you can come out to the car. If we can come out to your house, I don't know if Carol mentioned this, so I'm kind of throwing a little bit of her thunder, but even with the van drivers, the meal delivery route, they're not going directly to the person and handing the meal to them. They're placing it on the porch, ring the doorbell, step away, make sure the person comes out to receive that meal, and we're going to start doing some of the similar things as well. We may not necessarily be able to be in direct space, but I can go to your house. I can stand on the sidewalk while you come out to the porch and speak to me. Those are some of the things that, like I said, we're also going to enact with our conservatorship program. I feel myself just kind of rambling and talking, which I know I can do a lot, so I'm going to stop. If you all have any questions for me, I'm more than welcome to answer.
The chair does have a comment. I usually have comments. Your phrase, helping make it better, is what we do. I would like to have a shirt with that on it, because that's what we're here for anyway, right? Helping make it better. We can't always make it better, but we can help try to make it better. With all the things going on, all the pandemic, all the issues and problems that we're facing, but helping making it better is what we do. So your efforts are appreciated. The efforts of everyone working in the family support program are appreciated. And I know from my own experience, when I used to deliver some Meals on Wheels, those meals are important, especially to those seniors. And just the contact with somebody is important. So thank you so much. Any other comments, questions for Mr. Lyons? All right, thank you. Appreciate it. Appreciate that support.
We'll get my Sharpie and buy some T-shirts. Get right. Services, we go make it better. Thank you all.
Maybe I shouldn't mention that. The next item on our agenda is the city planning. Harper, and are you going to be joined by your partner?
The backup.
The backup. Okay. Thank you so much. So, Garrett, go ahead. We appreciate it. Here's the microphone. You can speak this way. Then you can take it off and talk.
They can't hear you. You can say
You can
right
say what you
there.
have to say. You can say what you have to say. Thank you, members of the commission. It's a pleasure to share some information pertaining to research and ways that it does and can address the work of Metropolitan Social Services. As we all know, recently our society encountered a number of serious and challenging issues, many of which relate to social and economic deprivations and inequities as experienced by African American communities. Nashville, as many cities, experiences visible displays of unrest and grievance over these inequities, including the punitive application of the criminal justice system. Protests have pointed to concerns about longstanding inequities and lack of response and change in the experience of many communities and situations. Some now call for divesting city resources from the criminal justice system, and instead investing those resources in human and social services. There's a widespread belief that minority populations are stuck in multi-generational poverty as a result of systemic racism, and only intentional investments in community development can lead to meaningful change. The Metropolitan Social Services Commission, through its mandate in the Metro Charter, conducts research and reporting on economic and social disparities in Davidson County. This research and analysis allows the Commission to bring forward to the community and its leaders underlying issues, causes of poverty, and how those have enduring generational and community impacts. Reducing generational poverty and the ways that poverty affects individuals and households and the entire community suggests that there may even be efficiencies, cost savings, and meaningful change in the community if focus on evidence-based research is used to guide policies and investments. Metropolitan Social Services has completed the annual community needs evaluation now for the past 11 years. And this is a signature document that examines the trends and patterns of Davidson County and poverty, income, education, housing, other topics. Recent research by national organizations also continues to deliver new and important insights into poverty and economic well-being. For instance, the issues of neuroscience and poverty, adverse childhood experiences, structural, economic, and social patterns, and community dynamics. And it's this type of rigorous research that demonstrates that programs and policies across the U.S. can and do move the needle on mobility from poverty. And filling this knowledge gap in terms of what understanding and addressing poverty and well-being is now more important than ever. Fulfills the mission of Metro Social Services and its commission. And this has been a priority to bring innovation and latest research to community leadership. Some of the important results from recent national research and work done by Metro Social Services includes recognition that disparity is often deep and enduring. Here, structural inequity over time by race, ethnicity, age, gender, neighborhood characteristics, family structure is resulting in enduring levels of poverty. Also, a really central research finding continues to point to economic mobility for individuals and households as essential to establish lasting financial stability. That ability of children in poverty to outperform their parents economically is critical. New evidence-based research offers a lot of insight into how this can be achieved through thoughtful, coordinated policy and investment. And this economic mobility out of poverty, according to the new research, is dependent on several factors, such as economic success through ability to earn, build household assets. It's dependent on individuals' real ability to control their lives and to make informed and supported choices. Research that shows that respect, dignity, and sense of belonging in the community are important for individuals to move out of poverty. That secure, stable home environments are critical to children's healthy development and educational later economic success. And that safe, inclusive communities provide social networks and support that create opportunity and stability. Together, this research shows that mobility from poverty takes time, but that wise policies do bear fruit over time. Cities can even become more efficient, more effective, and experience cost savings through long-term investments that change the course of the community in education, thriving neighborhoods, abundant jobs that
skills of the workforce in creating healthier and more supportive environments. So altogether, since poverty and well-being are very multidimensional and comprise many factors, Metro Social Services is able to use ongoing and new research to fill this knowledge gap, not only about the conditions of poverty, but the causes and interrelationships that can be understood. The ability of social planning provides the agency and the commission with the important means to fill this knowledge gap and to offer the community deep insights, information, guidance on ways to enhance and expand well-being for all residents of Davidson County. It really is an exciting and certainly important time for Metro Social Services to bring to the forefront these interrelationships of poverty, mobility, and opportunity. We'd like to thank you for your support and encouragement in ways that this agency can continue to be the city's leading agency to analyze and help inform and guide the community. I just want to mention two recent examples where Metro Social Services was called on to provide key research on community initiatives. The organizing committee for the tornado response by the city sought out Metro Social Services as the data and research arm for their work. We've provided mapping of damage that's being used for upcoming canvassing of damaged homes and structures. Also, longitudinal study by Vanderbilt scholars on the impacts and effects of socioeconomic conditions for children by neighborhood in Nashville has sought out Metro Social Services for consultation on research and mapping needs. So just mentioning those examples where we're called on to provide unique and important research for the community. So I'll close with that. And again, thank you, commissioners, for the time to share this information.
Thank you. Any questions, comments for Gary? I will make a comment, as I usually do. Thank you so much. And thank you, Aviana, for being here also. We appreciate that. And this is something that we get busy meeting the immediate needs of clients. And we've heard today about all the needs that this organization is meeting, or trying to meet, and trying to make things better. But research is something that we sort of tend to forget until we see the practical application of it, as you pointed out in those examples. And it verifies, it helps us verify information. And why do we need to verify information? We need to verify it so that we can make good decisions in the future in terms of programming, planning, leadership, and giving it to leadership and helping them see it in the numbers and in the people that we serve. So thank you very much. It's a very, very important, very vital part of what we do. That's why it's in the code. Thank you so much. Appreciate it. The next item on our agenda is new business. No new business. And we move to the next item, which is old business. And Ms. Pratt, talk about the budget. Thank you.
Mrs. Hancock spoke about the budget earlier in her presentation, and the proposed budget that was recommended to council, which was accepted by council from Councilman Mendez. His budget proposal was the one that went forth. Again, we have to have that information in, and we need the information to departments by June 30th. So we don't have a final budget as we speak, as Ms. Hancock reported. But we hope to have one or receive that information over the next few days. Once we receive it, we will send it out to the commission so you will know what our budget is for the coming year. Thank you.
Okay, I appreciate that very much. Any comments or questions for Director Pratt? We're now to the point of adjournment. Do I hear a motion for adjournment?
I'll make a motion for adjournment. It's Charlotte.
And second? Do I hear a second?
Second.
Okay, thank you. Now I will ask the members to vote by name for the motion. The chairman votes aye.
Pastor Harris, aye.
Charlotte Peacock, aye.
Brandon Tompkins, aye.
Mr. Orr? Mr. Orr?
I'm going to try to unmute
Aye.
him here. Oh, there he is.
There he is.
We appreciate it. With that, I'll make one more comment before we actually adjourn. Thank you so much for your efforts and your time today. This is very unusual, but based on knowing the people that we have, both on the commission and staff, I feel confident we can get through anything. So thank you, and the meeting is hereby adjourned.